how does obesity impact heart health,
Hmm.
and why men having abdominal obesity is a major risk factor for developing heart disease.
See, obesity, the amount of, see, when we say obesity is BMI, we calculate basically scientifically based on body mass index more than 30. See, in obesity, the pressure on the heart or work on the heart will be more. Generally, it undergoes secondarily hypertrophy. Then the a person may develop pulmonary hypertension secondary to obesity, which we call it as carpulmonale in our scientific medical term. So that will increase the risk of obstructive sleep apnea. That secondarily it will increase the risk of carpulmonale, and obesity once is also a state of chronic inflammation. So that is how it will lead to coronary artery disease, stroke, heart failure. And in men, as you told, abdominal obesity we generally measure by waist hip ratio, which we in men it is more than 0.9. We say it as abdominal obesity. It is always not the outside fat which is responsible for the disease. It is the metabolically active fat which is inside the organ which is responsible for heart disease or inflammation which is happening in the body. See, generally if the abdominal obesity is there, they are more prone, they will have more insulin resistance, because insulin acts on the fat cells. If number of fat cells are more, the resistance for the insulin will be more, then they have more chances of developing diabetes, hypertension and other issues secondary to obesity. That is how they are more prone to develop heart diseases.